I think one of the great challenges we have in society is that people associate palliative care with death and dying. And so it's become a very negative concept, a very negative word. So we have to change that around. We have to change the culture that palliative care is about living. It's not just about dying. So I think we have a real challenge to change that, that perception around. There are many different innovations that one can introduce depending on the type of service, whether it's a service that's in the community, whether it's a service in a hospital, whether it's a palliative care unit or a hospice. But I think that there are two things that I want to highlight, amongst many others. But one of them, I think there's a very important role for palliative rehabilitation. In Ottawa, Canada, we had a program that we started called the Palliative Rehabilitation Program. And it surprised many people because they don't associate rehabilitation with palliative. But then they soon started seeing that for patients who still have many months of life left, doing exercise and eating can help their quality of life and can actually keep them independent and at home for much longer. So I think that concept of rehabilitation we can start bringing in. The second thing I think is extremely important is that specialist services, palliative care services, need to recognize that we need to work alongside the other specialists and the other primary care services. So it's not feasible and it's not sustainable for a small group of palliative care specialists, no matter whether you work in a hospital or in the community, to do all the palliative care. So we need to work together. In the same way, it's not appropriate that every single patient with high blood pressure has to be cared for by a cardiologist. Family doctors have got an important role, the primary care nurses. So in palliative care as well, I think we haven't done a good enough job to say we have to spread our expertise to other specialty areas, allowing them to do the basic palliative care, or what we call the palliative care approach.